So we've been called to a 23-year-old male who's complaining of a severe headache. We've completed our primary and secondary survey. The patient's symptoms are one-sided pain. He has no allergies. The only medication he is taking is for migraines. However, he has run out, and that is his only past medical history. He's otherwise fit and well. Our full set of vitals returned normal, and so therefore we followed into further subjective questioning following the Bish guidelines. So the patient is described that he only gets the one type of headache, usually once a month, that is quite severe. He medicates for this, which has been prescribed from his GP for migraines. However, he has run out. So that is the reason he's called this time, as he has no medication to take and no pain relief in the house. It has been a gradual onset today, over about 2 to 3 hours. It has been worsening and he has not resolved. The character, he rated it 7 out of 10 on the pain scale. And it's a throbby pain on the right side, behind the eye, into the top of the head. He has no associated other symptoms with this, and it does not spread anywhere. Usually he will take himself into a dark, quiet room. Unfortunately, he's tried this and has not helped. That combined with the medication, which, as we've mentioned, he does not have. In between these, he is fine and well, with no residual symptoms or anything like that. Next, we'll be looking at completing some focused special tests for the headache. So first of all, looking for any meningeal irritation for conditions such as meningitis. So that's the Koenig's and Brudzinski sign. So Alex, what I'm going to do is I'm just going to passively lift your leg up, and I just want to let me know if there's any pain. Okay? So you just relax for me. Just straighten that leg. Any pain with that? No. No? No pain? Cool. So that's a negative test. Next, we'll be looking again for meningeal irritation by passively lifting the neck up. So Alex, do you mind if I'm just going to lift your head up for you? Is that okay? Yeah. You just let me know if there's any pain. Is that okay? Yeah, that's fine. And again, that's a negative test. There's no pain, and what we'd be looking for is flexion of the hip and knees. The next test we'll be looking at is for neutral rigidity. So that's looking at any muscle spasms around the back of the neck. So Alex, what I'll get you to do is just moving your head left and right for me, and up and down. Is there any pain or tightness with that? No. And do you mind if I just have a little feel behind the neck there? Again, just feeling for any muscle spasm, which we can't feel, and that's not painful at all? No. Cool. So we'll be looking at assessing the cranial nerves next. So that's performing a set of tasks that I'll ask the patient to do. So Alex, we'll just work through a few tests here if that's okay with you. So first of all, just wondering, have you noticed any change in smell? No. No? Cool. So the next test we'll be looking at eye movement. So I would usually have my pen light to be looking at the pupil reactiveness, but we'll, for the sake of the OSCE, be using my fingers. So Alex, I'm just going to shine the light into your eyes. I'll just get you to focus on a spot on the wall, please, and keep your eyes open. Cool. That's all fine. And I'll just get you to follow my finger, please. Just looking for any nystagmus or saccading, which is all looking good. Cool. Okay, and then I'll just get you to scrunch your face up for me, please. Cool. Open your eyes right up. Poke your cheeks out for me. And I'll just get you to hold them there. Do you mind if I try and push? Don't let them down. Cool. And open your jaw up for me. Now don't let me shut that jaw. And push side to side. So the muscles are all looking nice and strong. Have you noticed any difference in your taste at all? No. No? And any difficulty swallowing? No. Cool. I'll just get you to open your mouth and say ah for me. Cool. That's looking fine. And so just sitting there, are we able to shrug your shoulders? Yep. Perfect. And then last of all, just poking your tongue up for me, and then going left and right. Perfect. So the cranial nerves are all looking good. So next on the list is looking for symptoms of temporal arteritis. So Alex is only 23 years old, so quite young, with risk factors being over 60. Alex, have you had any pain in your jaw at all? No. No, his temperature was normal, so he does not have a fever. Have you had any disturbances with your vision recently? No. Any scalp sensitivity? No. No? Do you mind if I just... No pain at all? No pain. No? Cool. And any stiff joints at all? No. No. Do you mind if I just palpate on the side of your... No, that's fine. Yeah. No No tenderness at all? No. Cool. So that's all clear. What we'll do next, as a bit of a safety net, in our CPGs we do have a red flag tool to use for headaches, just to make sure we haven't missed anything. So Alex, we're just going to go through this together. A lot of it we have covered, but just to be sure. So you haven't had any neck manipulation or trauma to the neck at all recently? No. No neck pain or stiffness as such? No. This wasn't a sudden onset. This happened over a couple of hours. Temperature is normal. You haven't had any persistent vomiting? No. We've looked at the neurological signs, which were normal. There's no altered level of consciousness. Worsening headache, recent trauma? No. You're not taking any medication? No. There was no signs of temporal arteritis. He's a male, so he's not pregnant. There's no family history of intracranial bleeding, no strokes in the past of the family, no. No family history of cerebral vascular abnormalities. And I know it's a bit of a funny question, but you haven't been having sex recently where the headache came on? No. Cool. So that's all fine. Although the patient has had previous migraines, these are symptoms that are more severe than usual, and he obviously doesn't have the right medication for this. Therefore, I would recommend that this is an orange and that the patient would need to go and see their GP within 12 hours. The patient hasn't had any medication or pain relief for the headache, so starting at the bottom of the pain scale, we'd be looking at paracetamol and ibuprofen. Before administering this, we would complete our drug checks, and I would also do that with my off-cider to make sure that it is paracetamol, that is not expired, and the same for the ibuprofen.
Hi, I'm Chris, and today I'll be demonstrating the management and treatment of epistaxis in a low acuity setting. Vanel, is it alright if I do some body checks and ask you a few quick questions whilst my colleague gives us some vital signs?
Yes, no problem.
Cool. With the bleeding, is it coming from both nostrils or just one?
Just my right nostril.
Okay, cool. Before I do those tests, I'm just going to get you to use these tissues here and just firmly compress on the soft part of your nose.
Yep.
Great. And just lean forward. Okay. Yep, that's great. And I'm just going to put this bucket underneath you here, just catching any blood that falls, or if you feel nauseous or like you're going to throw up, you can throw up into there. And just breathe out, breathe in and out through your mouth. We're going to do this for 15 minutes and hopefully the bleeding will reside.
Okay.
Tasu, would you please be able to get me some vital signs and a 3 relay this information back to me when you have it, please?
Yep. Okay.
Cool. Vanel, what has happened today and what were you doing before your nose started bleeding?
I was watching TV, and while I was watching TV, I pricked my nose and pricked it real hard, and it started bleeding and wouldn't stop.
Okay. Are you in any pain at all?
No.
No? Do you have a history of nosebleeds like this or any past medical history?
No.
No. Do you have any allergies?
No.
Are you on any medications, in particular anticoagulants such as warfarin or dabigatran?
No.
No. When was your last oral intake? The last time you ate or drank anything?
About 3 hours ago.
Okay. Do you smoke or drink at all?
No, I don't.
Okay. T, what were those vitals?
Yeah, blood pressure was 110/70, heart rate was 80, saturating at 98, normal sinus rhythm on the free lead, 36.4 temperature, 6 BGL, cat refill time of 2 seconds, and rest rate was 21.
Okay, so those are all pretty normal vital signs.
Yeah.
Vanel, do you have any nausea or have you vomited at all?
No.
Do you have any headaches? Okay. Now, after assessment, it's found that there was no neurological, respiratory, cardiovascular, gastrointestinal, or traumatic involvement with your nosebleed. It appears that it's mechanical from picking your nose. It may have ruptured some small blood vessels in there. This is reassuring because we have the knowledge to be able to manage this, and we have the treatments as well.
Okay.
For now, after 15 minutes, it appears that your nose hasn't stopped bleeding with that compression alone. So we're going to recommend adrenaline. This is a safe procedure. It's very effective and it doesn't hurt at all. Would you be alright with us administering this?
Yep.
Cool. In this case, adrenaline is indicated for moderate to severe epistaxis. The mechanism of action is it stimulates alpha-1 receptors, causing vasoconstriction in the blood vessels in the nostril. There are no contraindications. It is cautioned for myocardial ischemia or any tachydysrhythmias, which Vanel does not have. It's given intranasally and works on contact. The usual preparation is a 1 milligram and 1 ml ampule. This will be diluted to 10 mils with 9 mils of 0.9% saline. This new solution contains 0.1 milligrams per ml and it will be given through mucosal and atomizing device, and the dose is 0.2 milligrams or 2 ml per nostril. Now, would you be able to blow your nose for me, please, as this will help to remove any blood clots?
Okay, cool.
Cool. I've got my adrenaline here. So it's adrenaline, 1 milligram and 1 ml, and the expiry is 2019. Chelsea, would you be able to confirm this for me, please?
Sure.
And read that back to me.
Adrenaline, 1 meg and 1 mil, expires, Feb in 2019.
Great, thank you. For drawing up the drug, I have my drawing up needle attached to my 10 ml syringe. Check for no air. Sharps away. Drawing up my 1 ml of adrenaline. Sharps away. Next I'm going to draw up 9 mils of saline. So I have a solution of 10 mils. And I'm going to attach my mucosal atomizing device. Then I'll put this up Vanel's right nostril and administer it slowly. 15 minutes after adrenaline administration and firm compression, Vanel's bleeding subsided. No additional dosage of adrenaline was required, and reassessment came back clear. We were able to leave Vanel at home, and we were giving him a clear set of instructions for further management and treatment should his condition deteriorate. Vanel, it appears that your bleeding has subsided, and me and my colleague have decided it's safe enough to leave you at home now. We advise that you go see a doctor within the next few hours, as they can do a further assessment. It's advised that you avoid hot showers, hot drinks, and blowing your nose, as this could cause vasodilation and a reoccurrence of that nosebleed. I'm going to fill out an ACS form for you here with that information, so that you can refer to that.
Yep.
Do you have a family member who can take you to the doctors at all?
Yep, my brother.
Cool. I'll let him know about the situation on the way out.
Okay, cool.
If it starts bleeding again, apply that firm compressor with the heat tool.
Yep.
Cool. And don't hesitate to contact us, as that's what we're here for.
Okay, cool. Thank you.